Paul Gray has written a very interesting report. I think it was commissioned for NHS Scotland, but I think it could be rolled out to focus on the whole of the NHS in the United Kingdom. And I think Paul Gray would be a very good person to lead some sort of review. We need a way forward, and at the moment we don't have one. At the moment we're just simply trying to stand still, and that's no way forward. Standing still is slipping backwards. So the health service, he says, is struggling, I would say struggling to breathe. It's exhausted, it's overrun. And he identifies 4 parts of the health service. Primary care, that's things like the GP, nursing, psychiatric nursing, health visits, dentistry, physiotherapy, and so on. Hospital care, social care, and private care. And you know, when you read those, you think your eyebrow goes up at the private care. Because of course, as he points out, there's a big debate about private and public, localism and central care. And when you look further, it's all about the range of providers, the variety of annual budgets, the accountability, and so much focus is on budgets and resources that there isn't enough focus on families and patients and families' needs and patients' needs. And too much is on the work of the hospitals and not enough on the work for the patients. He also talks about the contribution of the private sector and the constant talk of partners. So the NHS is already partnering with the private sector. So we need to look at how that works, and indeed, private healthcare is generally dependent on the NHS anyway. In order to get private healthcare, people need to have a recommendation from their GP. So in the UK, the difference between private and public is not as clear-cut as it would be in some other countries. And maybe we don't have a sufficiently integrated social care. One of the problems of a failing primary care, which Gray points out, is that when people try to access the healthcare system, they have already become acutely unwell, and they are often past that first point of call, which maybe they can't access. So that dysfunctional primary care then has a huge impact on hospitals when they turn up at A&E and they have to be treated for serious diseases when a year or so earlier they could have been that serious disease could have been prevented. The article points to significant advances in other countries like Sweden, the Netherlands, Alaska, where developments have been rolled out that provide social support or local support for local care. So a localized system rather than a centralized system. That may well be the way forward. At the same time, it has to be a local system that is bureaucratically linked with a national system, and at the moment that clearly isn't the case. He says there's 2 lessons of the pandemic. I think there's 3. The 2 lessons he identifies are, number 1, that change when we need it to be can be quick. Number 2 is that technology can help. Technology can help in terms of diagnosis, care, and treatment. I would add that bureaucracy needs to be streamlined. So at the moment, we have a bureaucracy that doesn't talk to other parts of the bureaucratic system. One hospital doesn't talk to another hospital. One NHS trust doesn't talk to another NHS trust. Even within the trust, there isn't proper communication. I have been in hospital recently twice. Once for an appendix operation, which should have been routine. It wasn't, because the John Radcliffe in Oxford wanted to do their own blood tests rather than consult with the Churchill Hospital in Oxford, part of the same NHS trust, that actually had all my records and treated me routinely for haemophilia. So while they were doing their exhaustive tests in the John Radcliffe, my appendix burst, which caused peritonitis. This was life-threatening. And it was life-threatening because of the stupidity of the bureaucracy. And even when the appendix operation was completed and the various tubes were removed, they were green. They were green because the system is still... I was deeply ill. And I was discharged from hospital, still deeply ill. And none of that needed to have happened. All they needed to have done in the 3 days while they kept me waiting while my appendix burst was for them to talk to the Churchill Hospital. And the same nonsense took place when I went into hospital for cancer. And in the process of removing a tumour, the haematology people claimed in the Coventry Hospital that they had spoken to the Churchill Hospital about my haemophilia issues. They hadn't. They hadn't. A simple conversation that I had later confirmed no such conversation had taken place. So instead of using focused medicine, which even I could tell them what to use, they used cheap medicine off the shelf, thought that would be okay, and 2 weeks later, my wounds opened up, entirely predictably. And I was back in hospital for a further 10 days in a life-threatening situation because of the stupidity of bureaucracy. So I would definitely add that in the days when we have Wi-Fi and effective computing, it is nonsensical for one hospital not to talk to another, for the patient's notes not to be immediately available, for the notes, in fact, that you see to be routinely seen in the same form in each case. So again, I asked for copies of a report that I was given, which was unfortunately lost because it got covered in blood. And what I was handed was something incomprehensible and completely different to what I'd seen originally. It made no sense. Why? And it took nearly 2 months to get that report. Why? I don't understand. Because the systems are not joined up. So that is a necessity, and that's been a necessity for some time. As for the private sector, and here I think Gray's deliberations are really interesting. He points out that the NHS doesn't make its own vehicles, it doesn't generate its own electricity, it doesn't make its own equipment, so it is already dependent on private expertise. And that COVID demonstrated that an active cooperation between private healthcare, the NHS, and academia, all these working together, generated the vaccine program, which otherwise wouldn't have happened so fast. So what we need to do is to harness the best in each part of the existing NHS. We don't need to reinvent the wheel. We just need to make sure that it moves smoothly. And at the moment, it's not. Anybody who tries to access the NHS through their local GP is going to find it terribly difficult. The system isn't working well. Anybody who tries to access private healthcare will find that equally is difficult. It's not working well. What we need to do is to look to countries where these things work together. Oddly, Turkey has now got a very, very well-functioning private-public healthcare system. If you are ill and you present yourself at any hospital, whether it's private or public, you will be treated. The private sector cannot solve, and this I thought was a very interesting point, the private sector cannot solve many of the problems faced by the larger NHS. The NHS thinks in years and thinks in long-term solutions. The private sector, like any private company, thinks in short-term solutions that can be funded. So the private sector would say, oh, well, we can only give this 6 months. But it doesn't need 6 months, it needs 4 years. I think the future of healthcare in the UK, as the future of healthcare across the world, is about it being a public and a publicly accessed resource. But there is a role for the private in all of that. It's already active. So this debate about private or public and the purity of the public access and so on is a debate about words only, and it misses the fact that the NHS is already drawing on private resources. So we need access, we need sustainability, we need a system redesign, we need restructuring to eradicate the waiting times, to eradicate the waste, and to invigorate the system so that it's a more welcoming place for people to work. We need a very, very short invigoration program would restore the morale of nurses and doctors working within the system. But I think part of that is the abolition of the needless bureaucracy. There is so much bureaucracy in the NHS, and yet at the same time one hospital doesn't talk to another. Patients' notes take forever to get to the hospital and to get back, and they go back in a different format. Simplicity of bureaucracy is what is needed, rather than the endless bureaucrats basically churning out more paperwork to keep their own jobs. Those jobs should go. We should halve the number of bureaucrats in the NHS. We should increase the amount of doctors and nurses, and we should make the bureaucracy that we've got work significantly better. That is where the focus should be. But I would be very, very proud of anybody like Gray who can see clearly what needs to be done. I think Gray is the person to oversee an investigation into the British NHS, but somebody needs to look at it soon, because given another year, this thing will be on the ground.